consultation, and client expectations. Purpose: a pre procedure consultation helps align the client's expectations with what can realistically be achieved. It allows the artist to explain the process, discuss options, and answer any questions, reducing the risk of misunderstandings. By asking these questions and maintaining proper documentation, you ensure the safety of your clients and the professionalism of your permanent makeup business. This comprehensive approach helps establish trust, reduce risks, and provide a clear framework for addressing potential complications or concerns. Client history and consent. Purpose: this form collects information on the client's medical history, allergies, medications, and past cosmetic procedures. It ensures the artist is aware of any factors that might affect the procedure or healing. Consent is necessary to confirm the client understands the risks and agrees to proceed. Emergency contact information. Purpose: in case of complications during or after the procedure, having an emergency contact ensures the client's safety and facilitates rapid response if needed. Hi again. So one of the most important part of doing permanent makeup on someone is your medical history form. This must be done. We must have them fill out the paperwork so we understand what they're going through and so that we know if they're a good fit for us. This is also a way to create common understanding between you and your client. Because guess what? If you don't ask the questions, you won't know the answer. And it does matter what they use on their face, how they clean their face, their lifestyle. It's something as simple as, okay, are they a construction worker? Do they work in dust? So when should you do the brows if that's the case, right? How many days they need to have off? That type of stuff is important. But most of all, you gotta understand what's going on inside of their body, because the brows, the eyeliner, the lip, the permanent makeup needs to heal. So let's go over that. The medical history form, first of all, it has to indicate that it is a tattoo. So here on all forms, which is attached to the module, we ask for their information, their name, their address, home phone number. All of this is in the demographics. Besides having it on a hard copy, for business purposes, you want to also collect this somewhere on a digital copy so that when you're ready to send out a mass text or email or anything like that, you're ready to go, right? You don't have to go back and go through every file. Now you can just hit that button, hit send, and say, hey, I have availability. So you want to also collect the demographics, not just on a hard copy, but also on a digital device somewhere, okay? In the state of Michigan, this is a legal document. You must collect this on your client, okay? Okay. You must be 18 years or older if you want to be able to get a tattoo on your own. Anyone under the age of 18 needs to be accompanied by a parent or guardian, and we have to prove that they are related to each other, that this person is responsible for this kid, right? So, with that being said, if you're going to perform a procedure on a minor, anyone under the age of 18, we need to complete a separate form. This form in the state of Michigan can be found on michigan.gov/bodyart. Okay? And then you look for a minor form, MINOR form, and you download that, print it out, and have the person fill it out and show proof that they belong to the child or the child belong to them. Okay? Okay, are you pregnant or breastfeeding? Anyone pregnant or breastfeeding should not be getting the tattoo done. However, if the person says that they are not pregnant and they look obviously pregnant to you, you do have the right to refuse the service, okay? Because it's safety first. So pregnant or breastfeeding, no. Oh, and most of the times it's not so much our pigment, it's if you're using anesthetic. If you're going to use anesthetic on the person, then the lidocaine can get through the bloodstream, and we want to be careful of that. Hemophilia or excessive bleeding. If the person had a bleeding disorder, then you want to get a doctor's note. The doctor has to give you approval to actually perform any type of permanent makeup or tattoo service on the client. The doctor should also give you a time frame as to how soon the service should be done, or what's the latest date you have to do the service. Because that person would be monitored, the doctor would give you an accurate time frame as to when you can do the service. So you want to make sure you ask for that as well. A history of skin disease, skin lesions, or skin sensitivities to soaps or disinfectants. We're going to go into the other question as well, which say history of allergies or anaphylactic reaction to latex, pigments, dyes, disinfectants, metals, or other sensitivities related to a tattoo procedure. If you ask someone which one of them are you allergic or sensitive to, and they can't give you a distinct answer, that's not your client. You'll have to let them go, because we use too many different products for us to take a chance with someone that has a lot of sensitivities and allergic reactions to stuff. We can do a patch test. Just be sure you know that when it comes to reading a patch test, we are not medical professionals, and so we should stay away from being the one to determine whether or not someone can have or should have a tattoo procedure done if they have a high sensitivity to soaps and products and pigments and everything else. Skin disease or skin cancer at the site of service. When it comes to this, you also need a doctor's note. You want clearance to make sure that this person is able to have the service done. A lot of times people want to get their services done so badly that they would forget how long ago they just went through the procedure. And so we want to make sure that they have clearance. Okay? If it's within 6 months, even within a year, they should probably wait till after that year to have the service done. Okay? And the thing about it is, especially if they went through chemo, because if a person has been through chemotherapy, then they are more susceptible to getting an infection than someone that hasn't. So we want to take care of our clients, and by doing so, there's more trust in what we do. So we want to take care of them. If they had cancer or skin disease in any part of the area that we're going to perform the service on, make sure we have a doctor's note for them. Big question. Would you perform permanent makeup on someone that has epilepsy, seizure, fainting, or narcolepsy? Some people might say, well, yeah, with a doctor's note. Others might say, oh, no, I don't want anybody fainting on me. Well, the thing is, they may not even know. The idea is that you are prepared to take care of your client. Doing some type of safety class usually helps with this, because then you would know how to respond to the person. It is really, really important that you know how to take care of your client. So taking a safety course, make sure you know how to deal with someone that may faint. If the person has a issue with it, meaning if it's something that they actually have a history of, you want them to bring someone that's aware of the condition with them. Make sure they've eaten, okay? And find out their triggers so that you can give them a beautiful service. Okay, next question. Have you ever had treatment with anticoagulants or other medications that thin the blood or interfere with blood clotting? Okay, so same thing like the hemophilia, right? We still want to make sure the doctor gives us permission to move forward with the service, because this is something that's happening inside of the body. And if it's a bleeding disorder, then it can interfere with healing. So we want to get permission from a doctor. We need a doctor's note for that. Okay, are you currently or have you ever used Retin-A, Renova, Lash Growth products, hydroxyl or glycolic acid, or Accutane? Okay, so any one of those could cause an issue with healing and pigment retention. The most important of all, though, is the Accutane, because with Accutane, they should stop taking it for a year before you break that skin. Okay? With all the others, they need to stop for 30 days. So they shouldn't really have a peel or anything like that within 30 days of the time that you do the procedure. But Accutane is a little more serious because it's a pill that people actually take to prevent acne. And so it remains in the body for a long period of time. So do you have allergies to anesthetic? Yes. It's industry standard to use numbing during the procedure. If the person has an allergy to anesthetic, you can have them use their own before they come in. That would really depend on their doctor, what the doctor want to prescribe for them, if they're allergic to the things that you use. But you want to ask them, because the last thing you want is to cause damage on someone who didn't even get a service from you yet. Just the numbing messed you up. Okay, so we got to ask that question as well. All right. Do you wear contact lenses? Have you had surgery around the eye area or have a history of eye disease? If this is the case, you want them to wait 6 months before they move forward. If they have any type of surgery or anything going on, 6 months should be enough after they had the service done. However, if it's a case where they had like a blepharoplasty, where you remove that skin over the eye, some people would actually come in to have the eyebrow or the eyeliner done a week after. We don't want to do that. We want to make sure that it's at least 6 months after they had it done, because we got to stretch and we don't want to cause any damage to the area that was worked on by the doctor. Okay, so let them wait if that's the case. Okay, the diabetes question, big one. If this person have any other known medical conditions which could increase susceptibility to infection or impair healing, they need to let you know. A big one is diabetes. Diabetes, I'm sorry, diabetes hinders healing. And so we don't want anything that would interfere with our process. So for this, they need a doctor's note. Diabetic people take a longer time to heal, which makes them more susceptible to infection. Don't let them tell you, oh, I had a tattoo last year and it healed well. You make sure you have your documentation to show. Okay? Because if they check yes on this paper and then all of a sudden they come back and it's 3 weeks later and it's still all soggy and raw, and you didn't get a doctor's note for it, you're going to be responsible. So you want to make sure you cover yourself and protect your client at all costs. Okay. Do you have a history of jaundice or hepatitis? If the person has a history of jaundice or hepatitis, you need to get a doctor's note for that as well. You need permission before you break into this person's skin. Okay? We're going to jump into the HIV question as well. Positive, a history of AIDS or positive HIV test. Legally, you cannot say no if someone comes in for a service and they have an infection. But you can get a doctor's note. You want to make sure that the person is safe enough to work on, meaning that you would not make them sick in any way by doing the procedure. If the doctor tells you yes, it's okay for you to perform this service on the client, then you move forward, which is a good thing because now you are doctor referred. A doctor is trusting you to put something permanent on their patient's body. And so you make sure you get a doctor's note, okay? Do not get yourself in trouble by being afraid and saying no. And I know you may say, oh, but Tia, this makes me a little bit concerned. I don't know if I'm trained for that. Yes, you are. You completed a bloodborne pathogen, and so you know how to handle your glove, you know how to remove your glove, you know how to put your glove on, right? You know how to deal with bloodborne pathogens. You know how to deal with a dirty needle. So you move forward with the service as long as the doctor gives you permission to do so. Have you ever had a cold sore, fever, blister, or canker sore? This is really important. With cold sores, herpes simplex virus, if someone has ever had one of these ever in their whole entire life, and we break into their lips especially, they are going to have a flare-up. 2 to 3 days later, they're going to be calling you saying, hey, what's going on with my lip? So you make sure they take an antiviral. Usually they'll call the doctor or their dentist and they'll say, I need an antiviral. I'm about to get permanent makeup done, and they're going to prescribe it for them. Valtrex is the most popular one. However, anyone would do as long as it's effective for that person and the doctor knows that already. However, they want to take it 3 days before, the day of, and 3 days after. So the 3-day regimen really doesn't work that well. The 7-day is a more of a complete one. So you let your client know that. So our next important form would be our body art procedure health risk consent form. And this form is telling your client everything that can happen during a tattoo procedure, because we're doing permanent makeup, but I'm going to say it again, permanent makeup is tattooing, right? And so they just want to make sure that you are informing the client of what can happen to them. So on our form, it says this information is not meant to scare you, only to better inform you. These side effects are rare but could include the following. And then it goes on to say infection, scarring, hypopigmentation, color migration, allergic reaction, corneal abrasion for the eyeliner, conjunctivitis, again, eyeliner, malaria, cold sores, pain and discomfort. To the bottom of this form, it says, I acknowledge receipt of the disclosure statement and the notice for filing a report. On our cards, it's here, and this is our aftercare. Okay, we also have like a QR code for them to schedule their next appointment on the card. And then the issues that can happen for the eyebrows at the back of it. Then they sign it, they print their name and they sign on the form. Okay, and this is included in the attachments on the module. All right, so that's it for that one. We're gonna go over the risk and consent form in another module, but this is just for you to understand the forms that's attached to the module. Okay, your photo release form, you need permission from people to post the picture. So we can't just be taking people's pictures and posting it and all that. No, they need to tell us that it's okay to post a picture. Okay, it doesn't matter if you're gonna filter it and make their skin look flawless and all that stuff. You cannot post their picture. No, if someone doesn't sign your photo release form and they say, well, I don't want to show my face, you do not show their face. You can crop out the art that you did on the person's face, but you cannot show the entire face. Now, if they have a scar through the eyebrow, a birthmark next to the eyebrow, 3 moles or a mole under the eyebrow, that's called an identifying mark. Same thing with over the lip. Same thing with if they have diamonds in their tooth and a special pattern. Anything like that, that's considered an identifying mark. And so you should not post their picture if they do not want it posted. If there's no identifying mark, you can post your art, but you cannot post the person's picture if you do not have a written consent form. And I say written because all clients have a tendency to forget sometimes. So we want to make sure that we cover ourselves. All right, and that's it for the photo release. Make sure you have one for every client that you want to post. Another really important form is your refund policy. You want to put as much information as you can on that sheet making sure that the client understands that this is a specialized service and they will not be getting a refund. Besides having them sign an actual document saying that they understand that there's not going to be a refund, make sure it's posted somewhere in your facility, visual. They can see it, no refund. Because it's not like they can bring back the service to you. Once you spend your time, your materials, your energy, your expertise, and your talent on that person, if they decide that, hey, you know what, I want to live like the Kardashians, but I can't afford it, and they decide to do a chargeback on you, you want to make sure that you give your processing company enough information and the documents they need for you to keep the money you've already worked for. So be sure to have a no refund policy that your client can sign, because if you put the work in and you're working and everything is legit, now be fair. Even if you have a refund policy and the person sign a refund policy, if you know that you could have done better for that person, you should remedy the problem. Don't just say, well, you signed a no refund policy, so therefore, that's bad business, right? We got to be straight up with people. If you're going to take the money, give them the service that they pay for, right? So I hope that helped. And be sure to look at the other videos for the other forms that need to be in your service packet so that you can give the best care possible for your clients and be fair to yourself. The procedure card, important, important, important. You have to remember what you put on the person. Do not trust your brain. Your brain is emotional. It doesn't remember. Do not trust your mind to remember what you used on the client. So write it down and write down the proportions that you did it in as well. You want to make sure you have a procedure card to know when the service was done, to write down any note about your client that you want to remember. People like that when we remember stuff about them. But most importantly, you want to remember what you used on the client so that if they come back and it's a little bit too warm, you can cool it down. Or it's a little bit too cool, you can warm it up. Or if it's just right, you just use the same thing again. So don't trust your mind to remember stuff. Write it down, okay? So you have your procedure card and you can rearrange this anyhow you want. There's no like real format for it. You can do whatever you want as long as it's documented. You've completed the course on permanent makeup forms and documentation. This is no small feat. It shows your commitment to learning and mastering the fundamental aspects of the permanent makeup industry. I commend you for taking this step. In this course, you dove into some critical topics that form the backbone of a successful permanent makeup practice. We explored why medical history forms are essential and how they ensure client safety and regulatory compliance. You learned the importance of health risk consent and how it protects both the client and the practitioner. We also covered procedural documentation, emphasizing why thorough record keeping is key to maintaining the highest standards of professionalism. By mastering this information, you've laid a solid foundation for a successful career in permanent makeup. Your dedication to understanding these forms and their significance positions you to excel in this industry. This knowledge is more than just filling out paperwork. It's about ensuring the safety and well-being of your clients. It's about providing a trustworthy and reliable service that your clients can count on. Thank you for your commitment and hard work throughout this course. We can't wait to see the incredible work you'll do in your careers. Remember, you now have the tools to ensure client safety, comply with regulations, and uphold professional standards. Keep pushing forward and let's shape the future of beauty together. But don't stop here. The journey doesn't end with this course. Be sure to check out our other courses and resources to continue expanding your expertise. The beauty industry is constantly evolving, and staying ahead means continuous learning and growth. Keep up the fantastic work, because you're not just on the path to greatness, you are greatness in the making. Congratulations once again, and thank you for choosing to learn with us. Let's go out there and make a difference in the world of beauty. The PDF of the forms are attached.